is you are talking to Mrs. Oliver and her 9 years old daughter Millie, and there was a letter, GP letter. Thank you for seeing Millie, who is 9 years old and has completed of central complaint of central abdominal pain on and off for last 4 months. Her attacks are painful and she has been sent home from school on numerous occasions. Her brother Saul has constipation, and I saw him 2 weeks ago. Mrs. Oliver says that she has no concern about Millie's bowel habit, but she is concerned at the amount of school she is missing. Examination today was normal. Although an organic cause is unlikely, I will be grateful if you could assess her to see if she needs any investigation further. And yes, so background information, weight and height on the 25th sentence.
Sorry, what is the background information?
A background, weight and height on the 25th sentence.
Okay.
So
Mrs. Oliver, its mother.
mother is Mrs. Oliver and daughter is 9 years old Millie.
Okay. 1 minute, please.
1 minute, okay. So Dr. Sana, will you please take the time? Is it possible? Will you please take the time?
Yes, I will. I will.
Okay.
9 minutes bed and then 30 minutes over, no?
Yes. And Dr. Tariq needs 2 minutes time to prepare himself. First,
Yes, you can take the time now.
okay, Dr.
The 2
Sana.
minutes preparation time.
Yes, Dr. Sana, are you ready with time?
Yeah, yes,
Okay.
yes.
Okay. Okay. Yes, Dr. Tariq, you can start.
Yes, it is the preparation time.
Do you need preparation time or
1 minute, 1 minute, just 1 minute. Okay.
okay, so Dr. Sana will take care of it. Yes, so by this time, Dr. Arman, would you like to do constipation scenario? Dr. Arman? Yes, Dr. Arman. Can you do the constipation scenario?
Okay, I'm ready.
Okay.
Doctor, am I
Sana, are you
audible?
ready?
Yes, you are audible, Dr. Aman.
Or I was not audible. Okay, okay.
Sorry, Dr. Arman.
Yes, now I am audible.
Yes, you are audible. I want to know that would you mind if I give you constipation history?
Constipation, doctor, I am not that much ready. I read although, but
No
I
problem,
want.
no problem. We are all with you.
Okay, okay.
Okay. Okay. So, Dr. Tariq, I'm ready.
Yeah. Hello, good evening.
Good evening.
I'm Dr. Tarit. I'm one of the child doctor here. I believe I'm talking to Mrs. Oliver, mother of Millie.
Yes, it's me.
Yeah. It's a pleasure to meet you, Mrs. Oliver.
Thank you.
So, may I know what is your main concern today?
Yes, Dr. Millie. She's now 9 years. She has last
Mhm.
4 months tummy pain And this tummy pain makes her the absence of school some very much odd.
So I'm so sorry to hear that. Um, so this pain in at what side?
I think it's around the belly button.
Mm-hmm. So now from when it started, you said 4 months before, right?
Yes, yes, yes. For last 4 months.
It is the first time or it happened before also?
Oh no, 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 just last 4 months.
Okay. And can you tell me about the character? How this pain feels like? Like it's severe pain. It's stabbing like pain. What pain? What type of pain he and she told you about it?
She is not. I asked her it before, but she's not so much specifically can tell about the uh, what the kind of this pain.
Hmm.
But she just all
Okay, no,
yes, just there's pain.
no problem. Okay, that's good. So, is the pain going to any other area other than the belly button?
No, 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 no.
Okay. And do you think it is associated with other complaints like any vomiting, any diarrhea associated with food?
Sometimes she told me about the vomiting. Sometimes,
Not all the time. Okay.
yes,
Sometimes
sometimes.
uh, you see the vomiting?
Yes, I saw, but it is I think is just uh, probably that time I forced her to take more food.
Okay. So, uh, as you said, there is vomiting. So, what about the amount of the vomiting?
Just little amount, and the vomits contained the food that before I have gave her.
Okay. And do you notice is there any blood or
No, 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 no,
undigested
no,
food?
no, no, no.
Okay. Okay. And at what times of the day the pain is more?
It has no specific time.
Hmm?
Anytime.
Okay. Okay. So, and do you think is there anything that makes it better?
Sometimes after taking food, this time this pain's relieved. I think.
Okay. And you noticed anything that can worse it?
No, no. But whenever I think that I forced her to take more food or taking talking him her to take food. That time
Mm-hmm.
I thought that she might complain of tummy pain.
Okay, got it. And if I want to give you a score out of 0 to 10, or the 0 is the no pain and 10 is the most severe pain she experienced. So how much you will give it?
6 to 7.
Okay, thank you for the information. So is there any tummy swelling?
No.
Okay. And you said only once vomiting. I think you don't have any other concern regarding this vomiting.
Yeah.
Okay. And what about his appetite?
Her
Sorry, heart.
appetite, yes, her appetite is good. Her appetite is good, but not like other children that I want to. But I think
Mm-hmm.
appetite is good.
Oh, okay. So, do you have any concern regarding her poop?
No, no concern regarding her poop.
Okay. And any concern regarding pee?
No, no.
Okay. And did she complain of any headache?
Yes, yes. She has doctor told that she has migraine.
Oh, okay. So, from when she's having this migraine?
For last, I think last 1 year.
Okay. So, who diagnosed this condition?
Our GP told us, and the GP told us that it's a kind of normal, that not severe migraine that needs the prophylaxis.
Uh, okay. So, do you taking? Did she taking any drug for this migraine?
On hearing, sir.
Yes, yes. Whenever there's pain, so doctor prescribed to give simple analgesia.
Mhm.
Mm.
Okay. Okay, that's good to hear. Okay, so is there any fainting attack?
No,
Any feet?
no,
Do you have any concern regarding her vision and hearing?
no,
Any weakness in any part of the body?
no,
You noticed any abnormal behavior?
no.
Okay. Does she looks like you or your partner, or she looks a bit different?
Um, she looks like her father.
Okay. And is there any fever?
Fever? No, now it is just occasional fever or seasonal fever.
Mhm. And do you have any concern regarding her growth, like her weight, her height?
No, her weight and height on the 25th centile, doctor told us.
Okay, that's good to hear. And what about her activity?
Is
Is she
good.
as active as before?
Yes, no, she is good.
Okay. And do you think is this pain is making awaking from her sleep?
No,
I
no,
mean, is
no,
affecting her
no,
sleep?
no, no,
Okay, that's very good to hear. And does she complains of any raising heartbeat?
no, no, no,
Any chest pain?
no,
Any repeated bug in the chest?
no,
Okay. So is there any abnormal hot or cold sensation?
no. I don't think so, doctor. Is it important? Is it any
No,
relationship with the?
just no. It's just a routine. We asked actually. That's why.
Okay, 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 okay.
Okay. And does she looks pale or paler?
No, I don't think so.
Okay. And is there any a color change of skin, like any yellow colorations or any other color change?
No,
Okay. And do you notice is there any skin rash in her body
no,
and any pain in the joint or bones, muscles? Any pain anywhere?
no,
Okay. And does she has any other previous medical condition?
mm, no,
Okay. And any admission needed before?
no,
Okay. So is there any any operation done, like any outdoor operation that doesn't needed any admission?
no, no. I think
Okay,
nine
that's good
months.
to hear.
Dr. Sana is telling
Yeah,
something.
5
Okay,
years now.
okay, okay. Yes.
Okay. And any recent trouble?
No,
Any team involved in her treatment?
no, no, no.
Okay. And would you mind if I ask you some questions regarding your pregnancy with Millie?
No, no, you can ask me.
Okay. Do you have any concern regarding his regarding her birth, like before her birth, during her birth, and after her birth?
No, not significant.
Okay. And the heel prick test was done just after delivery, after the delivery?
Yes, it was normal.
Oh, that's good to hear. And do you have any concern regarding her walking, talking?
No, no, no.
Okay. So can you please tell me her food habit? I mean, what she supposed to eat now?
She is on family diet and uh,
Hmm.
yes, major meal. She takes, but it's a small amount, but she likes, and especially she is fond of spicy food, pasta, chicken fry.
Okay. Okay. And does she takes adequate water? What do you think?
I have to told repeatedly to her to take water, but she's not
Okay.
too much fond of it.
Okay. And all the jabs given,
Oh yes,
is she allergic to any drugs or any medicine?
no.
Okay. So any other family member having the similar problem?
Ah, yes. That her my child has constipation, and doctor told that due to constipation, he has tummy pain.
Okay. And
And
any
doctor,
other
I'm very much worried that because my sister's she's my second cousin, has the Crohn's disease. So I'm so much afraid of this.
okay, I'm so sorry that your sister has this. Okay,
My
we'll look
second
into it.
cousin, my second cousin, but I'm
Second cousin.
yes,
Okay.
yes.
Okay, okay, we'll look into it. And any other condition, a chronic, any other long-term condition running in the family?
Yes, diabetes, hypertension.
Okay. So can you please describe your family to me?
Yes, I have two kids, and
Mhm.
me and my husband, we are the family.
Okay. Who is the earning member in your family?
His father, and recently she's army officer, and recently he moved to another city for last 2 months, and I think that after the leaving us, his pain is increasing day by day, the frequency is increasing day by day. I don't
Mhm.
know why it is.
Would you mind if I ask you about the family dynamics, your relation to your partners, and you and your partner's relation to your siblings,
It's
to
good, I
your
think.
child's? Sorry,
I think it's good.
that's good to hear. And is the income satisfying your
I think
financial
time
needs?
up.
Time is up. I'm up.
Okay. Thank you for your time,
Yes.
Mrs. Oliver.
Okay, present your case.
So today I have taken history from Mrs. Oliver, mother of 9 years old girl Millie. She is having central abdominal pain for last 4 months, which is intermittent, and sometimes it's associated with vomitings, relieved by taking food. In the background, she is also having a migraine for last 1 year, which is relieved by taking simple analgesics. There is no concern regarding her height and weight, and there is no significant family history. Only there are constipation, and all the second cousin has the Crohn's disease. Her food habit is also normal, but she used to take spicy foods and less amount of water. And if I had enough time, I will also want to know about the impact in her daily activity and the parents' daily activity. So,
Okay. So what's are
collecting
your differential diagnosis?
collecting all the information, I want to put my first provisional diagnosis is it can be a case of functional abdominal pain, and differentially, it is possible that there may be it can be due to constipations, although there is a family history of the constipations. Um, Yes, I want to put only these two for this condition.
Okay, okay, no problem. And so, how do you want to do any investigation?
Actually, the diagnosis is if it is the functional abdominal pain, it is diagnosis of exclusion. So we can do some tests to rule out the other differentials. Like if we want to put other organic causes, we can we can do the celiac scan, cystic fibrosis scan, and we can also rule out the inflammatory bowel disease. So to do this, we can check the blood. In the blood, we can check full blood count, erythrocyte sedimentation rate, and C-reactive protein levels, and we can do the urine routine microscopic examinations as this is a female girl, so to rule out the urinary tract infection, and can also do stool routine microscopic examinations to see is there any infections in there or not. And if needed or surgical cause is suspected, only that time we can do imaging like X-ray of the abdomen, ultrasonography of the abdomen. And if all these things normal, but the pain persisted, then we can also think about the MRI.
Okay. So how will you like to manage this child?
Yes, I want, as I took the history, I want to do the details examinations of the child, specifically looking for abdominal examinations, and also want to plot, yeah, his height and weight in the center, fifth centile, okay. And then I also want to do the general examinations related to that, like is there any anemia, any dysmorphic features, any jaundice in there. And after doing the investigation that I have mentioned, if needed, then I will counsel the parents and educate the parents about the nature of this condition, that mostly it is a functional pain. The pain is real. If the pain is there, so we may need to give some simple analgesics. And also, as the child is taking too much spicy food and less water, so we have to also educate the child and also the parents about having adequate fiber containing diet and healthy foods, and also having adequate fluids. And yes, I also want to involve the multidisciplinary team here, including a dietitian. First I want to involve my pediatric consultant, then I want to involve dietitian, and also if needed I want to involve child and adolescents mental health service, as I'm suspecting it can be a functional abdominal pain.
Okay. So, okay. So, tell me, will you please tell me the warning sign of abdominal pain?
Yes, obviously, if the child is very young and complaining the abdominal pain, and if the pain is mostly away from the umbilicus and the pain is very much localized, and if the pain are associated with other gastrointestinal problems like the child's having the persistent vomiting, the child's having the diarrhea, specifically the nocturnal diarrhea, and having the blood in the stools, and there are some general feature associated like associations like the child's having the unexplained fevers and weight loss or failure to thrive. uh,
Oh,
yes.
okay. Okay. And I think, is the time over, Dr. Sana? For crossing the time is over?
No, actually, I didn't
No problem.
calculate the
No
time
problem.
of question.
No problem. Actually,
I
there
just
is,
uh,
yes,
yeah,
there is
calculated
one
after.
question also.
Yeah.
Okay, so Dr. Tariq, well done. First, I will give my conclusion, and then Dr. Rima or anyone. So first of
Yes, please. Thank you.
yes, yes. So first of all, the thing is that um, your repo all was good, but if you want to take any kind of permission to take the note, the
Oh, yes.
yes,
Yes.
okay, and then before that you asked me to describe the pain. Yes, so uh, yes, Dr. Sana, will you please mute yourself? Okay, yes. Because your voice is so much breaking, so we can't hear you for this reason. Okay, and then for description of the pain, and from the description of the pain, suddenly was is that um, not just completing the Socratics, that site, onset, character, then radiation, aggravating, relieving, and then timing, and then the severity, and then is there any association? Okay, and if you do in this way, so you get the more information in a systemic way. For me, I'm thinking, and then in association you ask me two questions at a time. Does it associated with bowel change, vomiting, throwing up? Some mentor told that it's better to ask one question. Okay.
Yes.
Okay. And some mentor told that after uh, elaborating your past, a presenting complaint, just ask two important questions, two to three important questions relating to this history. Which important? This any throwing up or vomiting, and any kind of what is the bowel habit. Finish. And then we will come to the constitutional symptoms, that fever, weight loss, daily activity, sleeping, and then the systemic review. As I have made this functional pain, I will ask in the systemic query, headache, any, because in my differential diagnosis is functional abdominal pain, functional dyspepsia, irritable bowel syndrome, and abdominal migraine. So
No
any,
migraine.
yes,
Yes.
any headache, any weakness, any part of the body, because following migraine there may be transient weakness. Okay, and then what about heartbeat, any joint pain, and any skin rash, because uh, inflammatory bowel disease is one of our most red flag sign. Okay, and then in his systemic review, I will ask about what's about her swallowing. Does she ever complain any painful swallowing? Because it's one of the red flag sign for functional dyspepsia. Okay, okay. So
Okay.
just ask five. I made six questions for this. In the systemic review, and then you have done all the past history, pregnancy, you all did so nicely. And but you don't ask me during 4 months of this pain, what did you do for this?
Yes.
Yes, I
Okay.
think it's
Good.
important.
That's
Yes,
important. Yes.
yes. And other history, alhamdulillah, good. And if you tell me to summarize this, so I will tell that today I see Mrs. Oliver with her 9 years old girl Millie. Millie has recurrent bouts of central abdominal pain for last 4 months, which makes her absence of school for last 2 weeks. What is the severity of the pain? And I told about what is the location of the pain. And in the history, her weight and height on the background is 25th centile, and from the history I don't find any uh, of the organic cause. However, there is a history of Crohn's disease, inflammatory bowel disease in second degree relatives, and mom is so much worried because she is thinking that due to absence of his father this pain is increasing.
Hmm.
Okay,
Yeah.
just finish. Yes. And then differential diagnosis. You put functional abdominal pain and constipation, but Millie's bowel habit was normal. So you can put this the four differential diagnosis for any recurrent abdominal pain. This is a functional abdominal pain, functional dyspepsia, irritable bowel syndrome, and abdominal migraine. So you can put this functional abdominal pain is okay, and you can say that it may be abdominal migraine because there is a history of migraine to this child. However, this pain doesn't radiate to, and it's not severe on and not long lasting pain. For this reason, it is my second differential diagnosis. It may be irritable bowel syndrome, but there is no bowel alteration, and it may be functional dyspepsia. However, she has no vomiting, one time vomiting, and but no history of swallowing difficulty.
Yes.
Okay,
So
and
you were saying that functional abdominal pain, there are all the four DD. So
yes,
it
yes,
is
according
better to
to
say all the DD here.
according to Khidit, Dr. Khidit's note.
Yeah, yeah, yeah.
Okay,
Yes, in the
and
kitchen room there are four DD.
yes,
Yes.
yes, I make go through for this scenario Mark Betty and Khidit. And in investigation, because this case is better written in the MAGBT, and all of the mentors follow the MAGBT. So better to say about that. What are the investigation? Full blood count, inflammatory marker, and suddenly you told about the cystic fibrosis screening. I think that I told no history of the calf.
Yes, I
Okay, so
mentioned that, and there's no history of the cup.
yes, yes. So, according to Mark Beatty, full blood count, inflammatory marker, screening for the celiac disease, and stool are and urinary and culture sensitivity, and also liver function test is important here. And then they did the imaging, only the abdominal ultrasonography for the reassurance of the patient. This all about the investigation. And now the management. Management, I just go through Mark Beatty, and it is written that first of all, the reassurance, family support, and family education. Lifestyle modification of the child, as you have mentioned, and there is simple analgesia, and as soon as possible return the child to the school. But after returning the child to the school, if there is the same pain arises and it makes her to absence of the school, so then refer to child adolescent child mental and the adolescent mental health. Okay, and we can say that to keep up the symptoms diary, and also liaise with school, and also the cognitive behavior therapy may be given. This all about, and we will tell the parents about the red flag sign, because we are inviting the examiner to ask the question, because I know about the red flag sign of abdominal pain. And the red flag sign, okay, red flag sign, as we know, that persistent vomiting, dysphagia, painful swallowing, GI blood works, nocturnal diarrhea, pain, anal lesion, arthritis, weight loss, fever. You have mentioned it. Yes. So this about, I think, and this if
Thank
you,
you. Thank you
yes,
so
yes,
much.
no problem, no problem. So anyone wants to give the any feedback?
Yeah, I want to.
Yes, please.
Yes, please.
Yeah. Yeah, yes, Dr. Tariq, you did great, Alhamdulillah. The mistakes has she mentioned, and I was having some same concerns. But in the management, I would like to say when you were saying that I will take after taking this focus history, I will examine. I think in that point we must say that we have to assess the severity of the pain. Either the patient need immediate management or in the long term. Long term, Dr. Roxana has told, but immediate management, like maybe the child is in severe pain. So if
Okay.
the patient needs immediate, yeah, immediate management, so we will involve our like senior, and we will give her some analgesia, or decide whether the patient needs any admission or not. Like accordingly, like this one, na?
Yes,
Then
that
in
is
a
a good
long
point. The child having 6 to 7 gradings, so it's a kind of moderate to severe pain.
yeah,
Moderate pain,
like
yeah.
yeah. So during general, after general physical examination, or after examination, we must decide that the patient needs immediate intervention, or the patient can be managed on in a long term manner, like this. No? Otherwise, Alhamdulillah, all are okay. And Dr. Osana has mentioned very well points. Thank
Okay.
you.
Thank you so much. Thank you.
So I have some comment
You.
about your history. First of all, it was nice and nice. Already everyone tell the opinion. So,
Thank you.
oh, okay, wait.
And I want to add one thing, as because
Yes,
this is
please.
functional abdominal pain, this needs to acknowledge that the pain is there. That's why they will be more. That means we are acknowledging that they have really abdominal pain is there.
Yes,
Al-
doctor, I said it. The pain is real. Yes.
Yes, yes.
Yes. Okay. Okay.
And
So
here
my
cognitive.
opinion is
Yes,
that
yes, please.
first of all, the problem is about your time management. You are taking the
Yeah.
history very slow. So you have not mentioned the managed properly, because you have missing
Mhm.
family, social, psychological history. There is their child has recently changed the school, his father
Mhm.
has transferred, school bullying. That is, they very choose school bullying. As the child is 9 year old, and she's girl, is she right?
Yeah, she's girl.
So here I think menstruation period started or not, you can ask.
Okay.
And also one thing in systemic analysis you have destroyed some time, like when the role play training migraine present, you tell that who diagnosis date, what drugs treatment he's taking. Systemic analysis actually not needed to just chief complaints and any other concern you need to analysis. But
Yes.
systemic,
Yes.
the
In this way,
important
I
question
can
you
sleep
miss,
sometimes.
time you destroy.
Yes.
And migraine, you just one important question you miss. Anytime anyone tell headache, you have to ask, is that headache is associated with morning vomiting? Because you, this is the red flag. Just this simple question you need to ask.
Okay. Yes. Yes. Got
Okay.
it.
Other who diagnosis,
Thank you.
what drug is that taking, not needed. It is not a headache history. Well,
Yes,
about
you're right.
past history, trauma, you have not asked. Surgery, you have not asked. 5T IOA, any investigation done? It's 4 months.
I think he asked surgery, probably
Yes.
surgery and trauma. He has asked.
Admission surgery.
Yes, yes. I thought.
Trouble asked. Trauma may be missed.
So these
Okay.
are you need to add, I think.
Thank you so much. Yes, it's important that as the mother complaining about the migraines, so this is the important thing that I need to cover. We don't need
Another
to.
thing, when she's telling the pain grade is 6 to 7, you are telling that okay, thank you for this information. No, you tell that I'm really sorry hearing that. Okay, 6 to 7 is
Mhm.
a very great. You're telling thank you because you get the information. Another, vomiting. You ask a guarding question like, I think we have no any concern about vomiting. You cannot ask like that. Do you have any concern about vomiting? The role player has this. She will tell that no, I have no any concern. You can't guard any questions. Like, I hope that in birth time there is no any problem occur. This type of lead question you cannot ask in history. Okay.
Yeah, yeah, yeah. Got it.
These are, and also in presentation you have not miss, you have missing that Dr. Rukshanapu is mentioned that, that is that army officer father had transferred, and the history is telling that that time his pain is increased, so he probably missing his father. And what are the causes of functional abdominal pain you find in the history? Tell me.
Actually, I cannot take the full social history. That's why some parts, but it was written in the paper that the child is missing, the child missing schools, and the father is away for last 2 months, and the pain is increasing. So these are
Yes.
the two social comment was given on the statement, but
Yes,
I
social is
didn't
one.
complete it.
Family dynamics, that is father, one thing. Another thing is she is not taking enough spicy food she taking. In here you find a clue. Spicy food
Mm,
taking, and not taking enough drink. That is another
mm,
to you are finding.
yes. Okay.
And red flag, if they ask in your history what is your red flag, they ask like that. In my history, that is family history of Crohn's disease, maybe telling the role play, that is in my history. So when we take the history, we need to exclude all the red flags. That is very important. Like family history, you ask one thing very good: nocturnal diarrhea. Is there any nocturnal diarrhea? Is there pain on the swallowing? Any pain in swallowing? That is you need to ask.
Yes, I missed it. Yeah.
And the poo, especially the back passage area. Any problem in back passage area? You have to ask that. And
Yes.
functional abdominal pain safety, I don't think is the safety needed to ask. Is there? Do you think any threat of safety in home? Any psychological stress is going on child life? These are. Or otherwise, okay, nice
Yes.
everything you want.
Okay.
I need to know one. I need to ask one question. Like Dr. Sana, this you said that you will involve the CMH in the in the first line of management, or you will wait or you will follow up the patient if the patient has same symptoms and the absence of school and other psychological like aspects. Then you will involve the CMH, or from the
Yes, yes.
start you will not
No,
involve
no, no.
the.
We will reinforce. to return back the child on the school. But if the symptoms then come again, then we will involve them.
Okay. So, like the patient is having some psychological factor, like the father is away. So, we will involve the only psychologist over
No,
here?
no, no, no. I think no psychologist.
No, no.
No, no,
Okay.
no.
So, after how many weeks or like months we will follow her?
There's no specific, but we will emphasize what is the main problem here. There is the absence of the school. So
Hmm.
we will return back the child as soon as possible. But after returning the school, if there the symptoms reoccur, then we will involve the child.
Okay, okay. So, so only there is one indication for involving in this camp, na?
Yes, yes, yes.
And what about like her dietary habits? For example, if she's not following the diet, so we will
But
involve the
dietitian, yes,
dietitian.
No, Dr. Tariq told that there is involvement of dietitian. But I
No,
think
no, no. Yeah, the management. Yeah, yeah. Okay, please continue. Yes.
yes. So I think there's no need of involving any dietitian because parents are not worried about her diet
Okay.
and her weight and height is normal.
Okay.
Anyone want to comment on this? That do you need to involve
The
the
child is
dietitian?
actually, yes, I said the child is taking a lot of spicy food and not taking adequate water. So maybe
Mhm.
dietitian can help in that.
This is under lifestyle modification.
Yes.
Okay, this is under
Mhm.
lifestyle modification.
Okay, okay,
For me, I think no, it's better not to tell about the dietitian.
Mhm.
okay.
And what about the pain doctor? For example, if we will follow the patient and despite of all the things are normal, we will involve the pain doctor for some analgesia or
Yes,
some
yes. No,
reassurance.
we can go for the simple analgesia by ourselves, and we will involve the
Mhm.
pediatric pain management team
Hmm. Like from the start or later?
from the start. From the start, education,
Okay.
reassurance, lifestyle modification, return back to school, simple analgesia, pediatric liars with school, and pediatric pain management team. This is from the very beginning, according to Mark Beatty. So, should we go for the second scenario?
Yes.
Okay, so your scenario is Arif, 5 years. Arif is 5 years old. He has constipation for last 2 years of age and now 6 months swelling. Mom is Mrs. Oliver. Take focus history and make the management plan.
Okay. So 9 minutes plus 4 minutes, huh?
Yes, yes.
Mm. So just 1 minute.
Okay. Otherwise, notice no health issue and CBC ultrasonography, renal function test all normal. Take focus history from mother, Mrs. Oliver.
Okay, CBC and what
Ultrasonography,
else?
renal function test all are normal.
Renal function test, ultrasound.
Dr. Tai, would you please take the time?
Yes, from now on, the preparation time.
No, I think when he We'll be ready then.
Okay, okay.
You please update this recording on your
Yes,
YouTube channel.
inshallah,
I
inshallah.
want to hear.
Yes,
Oh, thank you.
yes,
Okay, doctor.
yes.
Uh,
Okay, so Dr. Tide, are you ready with your time?
Yes.
Okay. Dr. Arman, you can start.
yes. Uh, Hello, good afternoon. I am Dr. Muhammad Arman Jaid, one of the doctors here in this hospital. Am I talking to with Mrs. Oliver, the mother of Arif?
Yes, it's me,
How can I address you?
Mrs. Oliver.
Okay, thank you, Mrs. Oliver. Uh, how was your journey to come here today?
It's normal. Thank you.
Thank you. Okay. Thank you for coming here to talk about the Arif's condition. What is your main concern? Can you tell me,
Yes,
please?
doctor. Yes, doctor. Arif is now 5 years, but since his second birthday, he had the constipation, and we are very much worried because recently he developed the soiling.
Okay. I am very much sorry to hear about this problem and related with the Arif. And really, I will try my best to help you. And before that, I want to take a detailed history for about the Arif's condition, and I will take some notes. Is it okay, Mom,
Yes,
Mrs. Olive?
yes, yes, yes.
Okay, thank you. Can you describe his this P problem, this constipation, a bit more for me, please?
Yes, as I have mentioned that for since his second birthday, he has he has constipation problem, and it is sometimes so severe that I found blood with this stool, and he sometimes started crying. I'm so much worried. How can I get rid of this problem? So I'm so much nervous also.
Yes, Mrs. Oliver, I appreciate your concern regarding the Oliver. I see you are a very keen mother, and we will try our best to help you. And can you tell me what is his this how his stool? How his stool about his stool? His poo?
Yes, yes, it's just like sometimes peel it, sometimes so
Mm,
much hard.
mm. Okay. And when first you noticed this, he is passing this hard stool,
From second birthday.
second birthday. Okay. And so what you did for that?
Yes, so they told GP told to increase the fluid, increase the fiber. We
Hmm,
tried.
which you tried. Okay. So still it is going on.
Yes, yes.
So he's complying with the this more full fluid and about the this what the GP told for that he is compliant.
Yes, we tried, but 5 years old child sometimes is fussy eater.
Okay. And is there any this abnormal behavior with this difficult stooling?
Yes, doctor. Yeah, I noticed that he has some holding behavior, sometimes holding the furniture and giving pressure for passing the poo.
Mm. So after straining and it is passing
Yes, but with very much pain.
very much pain. Okay. So and he has any illness this since when he started this constipation, he got any illness?
Uh, uh, Before for last 3 years, I don't think so much illness after this has developed. I don't think so.
So can you observe anything which increases this difficulty in poo?
I think whenever he took less water.
It is increasing, and
Yes.
if decreasing with this some compliant with the treatment, like taking more food, more water and fiber, like that.
Yes, and sometimes we have to give the in we call it easy life sodium
Mm.
picosulfate.
He has is he any showing this any holding behavior like crossing of the legs and arching back before going to the toilet?
Yes, I have mentioned it.
Okay. And since when you observed this soiling?
So I need for last 6 months.
Okay, 6 months. And he has fever.
No fever.
And what about his this? He's losing his weight, or it is
He's losing weight. No, I don't think so.
his health is good. Otherwise,
Sorry. Sleep. Yes,
his
sleep is good.
okay. So you have taken anybody has taken his height, weight, and plotted in the growth chart.
Yes, it was normal 25th center.
20%. Mhm. And mm, so his what about his appetite?
Yeah, he is fussy eater
Mm,
and not so much bad, I think.
and regarding his nutrition, he's taking this what is feed he is taking
Sorry. What?
his food, regarding his food, what food regularly he is taking?
He's taking food is just our family diet.
Family diet. So other this mm, and he has any jaundice. You observed any yellow discoloration in his eyes?
Sorry, doctor.
You observed any yellow discoloration in his eyes?
No.
Any joint pain?
No,
Any joint swelling?
no.
And his is any abnormal, unusual features in his face?
Nah, no.
Okay. So
Yeah, yes.
and now I want to ask you about his some any he has any chronic disease
No,
He is followed by any team,
no.
and
9 minutes.
he is taking any medicine.
Yes, sodium picosulfate occasionally when needed.
Okay, okay. And he was admitted before for any reasons in the hospital.
No, no.
Okay. And, mm, and do you have any concern about his when he was in your tummy?
No, doctor.
So after birth,
No, doctor.
and during the birth process, any problem?
No, doctor.
When first time he passed his first poo after birth, you
Yes,
remember?
within 24 hours.
Okay, nice to hear. And this he has any you have do you have any concern about his development in relation to peers,
No, no.
and all the steps taken?
Yes.
Any allergy to food? Any food?
No.
Okay. And this so I want to ask you some questions which we are asking you everybody. Can you describe your family?
Yes. I have three other kids, and all of are normal. But in our family, there is constipation in a maternal side. In his maternal side.
So, any this chronic disease in the other than this constipation, any chronic disease in the family
No.
or in no? And, by um this and any he's going to, as you mentioned, he's 5 years old. He's going to a school,
Yes, normal school.
normal school. Any problem in the school?
Yes, yes, doctor. Recently, due to this soiling, he has to face a lots of bullying in school. So nowadays, for last 2 days, he's afraid to go to school.
Mrs. Oliver, I am so sorry to hear about this, that he's for his problem, he's suffering a lot, and he's getting bullying. So I am so sorry to hear that. And so now he's missing school regularly, not going.
Last 2 days, he was absent.
And this any school is informed about his problem
No,
in the school.
I thought I have to talk with the school.
Okay. So, do you have any concern about your financial issue?
No, no, no.
So it is satisfying to you.
Yes, yes.
Okay. And this how this is impacting you for taking care of
13
your
minutes.
children. Thank you
Okay.
so much.
Okay, thank you. Please summarize.
Today, I took history from Mrs. Oliver about Arif's constipation. So it started from his second birthday, and he also has soiling. And for this, they took treatment, but this is not successful. And he's not that much compliant with the this advice of the GP. So this is continuing his problem, and from the this his previous illness. We know that he is taking medicine, and but no other issues of no chronic disease in the family, no chronic disease of him for other than this. And there is a family history of constipation in the maternal uncle side, maternal grandmother side. And from his social history, I got that due to his soiling, he's bullied in the school, and that for that reason he's suffering a lot, baby, and not willing to go to school. And mother also have concern for this his attendance of his school, and this constipation is going on. So this my this provisional diagnosis is mostly constipation, functional constipation.
Okay, so are your differential diagnosis?
1 minute 48 seconds.
Yes.
Okay.
And what are your differential diagnosis?
Yes,
No, your provisional diagnosis is functional constipation. So what are your differential diagnosis?
yes, Dr. Roxana.
Okay, okay, sorry, sorry, I was muted. So what are your differential diagnosis?
From this history, I did not get anything else except this is a functional constipation. So, my probable differential diagnosis, this is constipation due to his lifestyle problem, and this is mm, maybe a lack of toilet training, but he's going toilet, and less of fluid and fiber intake, dietary not taking well.
Okay, so do you want to consider the celiac disease, cystic fibrosis, spina bifida in your differential
Yes,
diagnosis? Because you don't
but
ask about me any lower limb weakness, any swelling in the back.
yes, I did not ask. So my probable differential, other differential diagnosis, although I did not elicit all this problem in the history, my differential diagnosis could be celiac disease, cystic fibrosis, food allergy, and this thyroid hypothyroidism, and spina bifida, and endocrine problem, hypothyroidism.
Yes.
Yes.
So what investigation would you like to do?
So if I suspect this is a hypothyroidism, which is most common, I will do thyroid function test, T3, T4, and TSH. And for this, I will do celiac screening. And for celiac screening, I will do total IgA and IgA based ATTZ and IgA based endomysial antibody. And if it is more than 10 times of the normal upper limit, no, I will it will be diagnosed as a case of celiac disease, and now not to do celiac biopsy. If it is the less than tenfold, I will
Any other
uh,
investigation? Any other investigation?
or I will do this for diagnostic purpose. This
No,
for
any other investigation for the diagnosis except celiac disease? Do you want to perform any other test?
yes, yes. For diagnostic, I want to do sweat chloride test also for for the cystic fibrosis, and for this also I will consider this to do this gluten challenge for if I think other if I consider it is a celiac disease.
What examination you would like to do?
Yes, I want to examine his general examination for his anthropometry, although this is here he is normal, about normal, 20th percentile. I want to examine general examination for his abdominal eye, any jaundice, any pallor, and mouth in the any mouth ulcers, and in the any tag in the back passage, and abdominal, in the abdomen there is if any abdominal masses, and also I want to examine his back for any this skin tag, dimple, and any scar, any for any surgery, previous surgery, and I want to also examine his perianal area for any infection, also rash for streptococcal infection, for which he may feel any difficulty, and also if any anal fissure and in a anal fistula, and is there. And I want to do this routine lab investigations,
Yes.
but
And how will you treat the child?
okay, so I will here this I will uh, this do this his educate. I will educate him for this regarding constipation and his lifestyle modification, and here he has soiling also, so I will ensure his uh, regular this bowel disinfection by this by Movicol plain pediatric formula for this about 7 days, and if it is bowel is passing, then I will give him maintenance therapy with this same drug, and also if his Movicol is not tolerate not well, I will add some additive laxatives like Sina, then picosodium
You want to
picosulfate.
involve any team, multidisciplinary team?
Yes, Masid, I will involve this for his behavioral problem. I want to involve this psychologist, and for helping him his behavior control, toilet training, and if he has I also want to him to involve him this dietitian, and also want to involve the school liaison with the school, for as because she he is suffering from the bullying in the school.
Okay, so some recall question: difference between functional versus organic constipation.
Functional organic.
Yes,
Okay.
functional versus organic.
Okay, so there will be if it is early onset the constipation, and constipations with failure to thrive or growth faltering, and if it is there is any abnormal features of if it is any bowel problem, like neuropathic bowel, and any the same signs symptoms of Hirschsprung disease, any new features for the spina bifida, and
Okay,
also
and what is movable?
Movicol. It is a this polyethylene glycol. It is a
Macrobal
strong
laxative. It's a macrobal
macrobal.
laxative. And how to
Yeah.
prepare this?
This is with this exactly I cannot remember now.
No problem. Can you tell me the dose of Movicol?
Movicol dose we
9 minutes.
Movicol dose we will give. Okay, even though time finished, there is by sachet. This is
Yeah.
according to
Yes.
uh, uh, for I think this is one to several sachet exactly. I cannot remember now.
No problem. No problem. So,
I think up to
and
I
what are the
think
red flags for constipation?
red flags for constipation is if it is early onset constipation, uh, early onset, that is not passing meconium in the within 24 hours, and signs failure to thrive, and for well, and this signs of this neurogenic bowel,
Okay, no problem.
and
When will it refer to gastroenterologist?
that yes, yes,
When?
if it is
Yes.
any red flag, this red flag, that means this organic cause, and he's improving with the compliant of the this treatment.
Okay. And then when you consider the rectal biopsy,
Excuse me,
when we consider rectal biopsy,
it's broken. His sound is not.
okay, okay,
It
no
is broken.
problem. Okay, no problem. I'm telling that
Point.
yeah, when referred for the biopsy.
Oh yes.
Okay. So just because my phone charge is less, and there is in Chittagong, there is water is everywhere, and I don't know how to go back to home. So
Yes, yes.
yes.
Biopsy, we suspect this is a heat-sprung disease. Like there is alternate diarrhea, constipation, and blood in the stools. In that case, we will go for rectal biopsy.
Okay, so there if there is failure to thrive, any abdominal distension, vomiting, family history of HASPA, and constipation since the neonatal period, and history of delayed passage of meconium. And
Mm.
doctor, I will give you the all the feedback in
Yes,
recording, because I have to go back to home, and there is huge water around our hospital. I will give the feedback of you, and Dr. Tarith, Dr. Sana, anyone to give feedback, just give, I think, give him personally.
Okay,
Okay?
no problem. Thank
Yes,
you.
I think it will be better.
And
no problem.
so
Because
today application will open
Yes, yes, yes.
at 2 p.m. or 3 p.m.
learning, this
2
is
p.m., 2
learning.
p.m.
I didn't getting the information from the website. I'm searching here.
Yes, 2
Okay,
p.m.
okay.
2 p.m.
So then you have to go early.
No, not for that booking, but yeah, everybody in hospital don't know